The name of our organization is the DeKalb County Board of Health, located in Decatur, Georgia. DeKalb County is one of the most ethnically diverse counties in the southeastern United States and home to a very large and diverse Asian American community. Our mission is to protect, promote, and improve the health of those who work, live, and play in DeKalb County through informing and educating the people and empowering the community about public health issues. DeKalb County Board of Health provides a variety of clinical care and outreach services for 5 health centers and strives to build health communities through population-based assessments, education, and prevention efforts. The DeKalb County Board of Health has consistently achieved a high TB disease treatment completion rate. This rate was 94% in 2015, 91% in 2016, and 98% in 2017, just to give you a little history, in all populations, including the AA, NH, and PI. In 2020, the Centers for Disease Control and Prevention recognized us as a TB elimination championship for implementing culturally appropriate and innovative strategies grounded in best practices that addresses the unique and diverse TB, LTBI epidemics in DeKalb County. Here at DeKalb County, we not only serve a diverse community, but we also employ a diverse staff that are passionate about working together to serve the clients, the community, and to give back by expressing our desire to serve them by listening, caring, providing needed resources that needed to help them in their daily needs to care for their families. Just being here for them day to day is what's important to them. Each individual that walks through this door that lives in our community, they come from an area that most of us cannot even imagine. They have lived a life to tell a story of things that we couldn't even imagine, the tragedy. Success is not only about about finances, and it's about the difference that we make in people's lives. And that's what we do here at DeKalb County Board of Health. I feel that when they come here, they're looking for something different. They're looking for the care that we provide. They're looking for a listening ear, and they're looking for the best healthcare that they haven't had the privilege of having before. So the communities that we serve, in a way, they serve us. They help keep us on our toes. They help keep us strong and mindful that to not take advantage of anything on a day-to-day given basis. So those are the kind of people that we serve. We're here to help make them better, and they help make us better along the way. Our goal is to eliminate LTBI, TB in AA, NP, and PI communities in DeKalb County to support efforts to enhance LTBI, TB community engagements and education. Culturally appropriate training curriculum for influential network agents covering topics on LTBI, TB, including the burden in AA, NH, and PI communities in DeKalb County. The ability of testing and treatment options and common myths and misconceptions related to TB, LTBI. We're here to provide educational material and recordings in various languages that everyone may understand. Educate on immunocompromised illnesses that increases the risk for LTBI, TB, and the best practices to treat underlying conditions to prevent LTBI and TB. As we all know, we can't treat the LTBI and the TB without treating those other underlying conditions. And we have to do that. We can't just, and that's what I love about the opportunity to have this grant. It not only gives us current funds, extra funds, or provide for us to assist with the LTBI, TB, but we also have to bring in the nutrition to talk about the diabetes, or counselors to talk about the HIV. Our community engagement activities will help create a demand for LTBI, TB testing, and the mini grant helps to increase their testing, their education, their knowledge, and their care to take care of all of their needs, not just one or two. We hope to increase the knowledge on the burden of LTBI, TB in AA, NH, and PI communities in DeKalb and in the United States. To increase the capacity to identify and correct myths and misconceptions about LTBI and TB. Increase the uptake of LTBI, TB testing services at the DeKalb County Board of Health by members of AA, NH, and PI. We're also going to increase posting of culturally appropriate and targeted social media messages on the burden of LTBI, TB in AA, NH, and PI, and encouraging testing in at-risk populations. We have established and we're ongoing communication with partners in the community such as CDC, state, resettlement agencies, community-based federal qualified health centers such as CPACs, Center for Pan-Asian Community Services, Medcare, Mercy Care, to name a few, partners to rapidly implement activities to identify trusted community level spokespersons such as faith leaders, teachers, community health workers, radio DJs, and local shop owners who will serve as influential network agencies. We are very much affiliated with the resettlement agencies since DeKalb County is the #1 destination for refugees and immigrants coming to Georgia. More than 90% of the refugees in Georgia are resettled in DeKalb County. Therefore, we work very closely with the IRC, Inspiritus, New American Pathway, and the state Refugee Center. Our partnership came about because we all are here to do the same thing, to implement activities that identify and develop a training curriculum and job aid tools to train and to communicate the burdens and importance of testing and treatment of LTBI and TB in AA, NH, and PI communities through the local media outlets, social media, faith-based venues, community events, and other community-based culturally appropriate venues, to develop a recorded 1-hour webinar for healthcare providers to educate them about the burden in our population and our communities within the United States and DeKalb County. We want to encourage them to test and treat LTBI among at-risk populations to raise awareness of the recommended shorter treatment regimens for LTBI, to develop and implement social media campaign strategies to mitigate and to address LTBI and TB myths, to develop and tailor education and outreach materials and/or leverage materials from the program and other TB elimination mini grants recipients through lessons learned, presentations during the monthly TB programs and training webinars. By having a vast partnership with the various communities, we're able to enhance all of this, to bring all of this about without it being too much of a burden on one organization. We all come about for the good of the community, to convey a high level of care and empathy, honesty, dedication, and compliance towards the community, to trustworthy and credibility. By them knowing that all of us are working together for the same good, it just opened up a more window of compassion and understanding for them to know and understand that we are here for them, for their health, for their families, for their community. We serve a large, diverse community with language barriers, cultural beliefs that cause myth and disbelief, lack of insurance, knowledge, and understanding of the impact that tuberculosis has on the community, on the nation. This grant gives us an opportunity to reach more people through social media, outreach events in the communities, and to complete pre-recorded educational webinars on the burden of LTBI, TB in AA, NH, and PI communities in DeKalb County and USA. The funding provides an opportunity to increase quantiferin TB Gold Plus testing to all foreign-born cases, suspects, and contacts to identify, prevent, and treat latent TB infection. It gives us an opportunity to do what we do best a little bit more for the clients and the community who needs it.